Welcome to Drugs Decode. Today we are starting a new series on pharmacology. This lecture is designed to all category of students easy to learn. We will teach you very important concepts briefly within short period of time. Before that, prepare yourself to study. Take 10 seconds to relax and calm your mind and concentrate. Okay, let's go. In this very first video, we're diving into the introduction to General Pharmacology. This session will cover some basic yet important definitions and key terms that form the foundation of pharmacology. Here's what we'll look at in this video. What is pharmacology? Key branches of pharmacology. Essential terms like drug, dose, receptors, and more. And a few tips to remember them easily. Pharmacology. Pharmacology is the branch of science that studies drugs, including their sources, chemical composition, mechanism of action, effects on the body, and therapeutic uses. It is broadly divided into two main areas. Pharmacokinetics, PK, what the body does to the drug. Pharmacodynamics, PD, what the drug does to the body, mechanism of action and effects. Pharmacology is essential in medicine, pharmacy, and drug development to ensure safe and effective drug use. Drug. A drug is any chemical substance that alters physiological functions when administered to a living organism. It can be used for treatment, prevention, diagnosis, relief of symptoms. Drugs can be derived from natural sources, plants, animals, microorganisms, or synthesized in laboratories. Pharmacokinetics describes how a drug moves through the body and consists of four key processes: absorption, distribution, metabolism, and excretion. Absorption is the process by which a drug enters the bloodstream from the site of administration. Example: oral paracetamol takes 30 to 60 minutes to absorb, while 4 drugs act immediately. Distribution is the transport of a drug through the bloodstream to different body tissues. Example: lipophilic drugs, e.g., benzodiazepines, accumulate in fat tissues. Metabolism, biotransformation, is the process of converting drugs into metabolites, active or inactive forms, primarily in the liver. Example: codeine is metabolized into morphine in the liver. Excretion is the elimination of drugs and their metabolites from the body, mainly through the kidneys, urine, but also through bile, feces, sweat, and lungs. Pharmacodynamics. Pharmacodynamics is the study of how drugs exert their effects on the body. It involves drug-receptor interactions. Drugs bind to receptors to produce an effect. Dose-response relationships. Increasing the dose increases the effect up to a limit. Therapeutic versus toxic effects. Desired effects versus harmful side effects. Okay, let's see some key terms. Before that, subscribe our channel to watch Pharmacokinetics lecture in next video. Receptor. Receptors are proteins found on cell surfaces or inside cells that interact with drugs to trigger biological responses. Agonist. An agonist is a drug that binds to a receptor and activates it, mimicking the action of natural body chemicals. Example: salbutamol activates beta-2 receptor, where it's called as beta-2 agonist. Antagonist. An antagonist is a drug that binds to a receptor but does not activate it, preventing natural substances from exerting their effects. Propranolol is a drug that binds with beta receptor, but it does not activate. Instead, it prevents the binding of other agonists. Thereby, it is called as beta antagonist. Therapeutic index. The therapeutic index is the ratio between the toxic dose and the effective dose of a drug. Simply says, the dose range between toxic and effective dose. Half-life. Half-life is the time it takes for the plasma concentration of a drug to reduce by 50%. Short half-life drugs require frequent dosing, e.g., paracetamol, T1/2 2 hours. Long half-life drugs need less frequent dosing, e.g., diazepam, T1/2 20 to 50 hours. Bioavailability. Bioavailability is the percentage of a drug that reaches systemic circulation after administration. IV drugs have 100% bioavailability because they straightly inject it into the bloodstream. Oral drugs have lower bioavailability due to first-pass metabolism. First-pass metabolism occurs when an oral drug is metabolized by the liver before reaching systemic circulation. Thereby, its concentration is greatly reduced. Adverse drug reaction. Adverse drug reactions are unwanted effects of drugs that occur at normal doses. We will explain to you more in upcoming lectures. Tolerance. It occurs when a person requires a higher dose of a drug over time to achieve the same effect. Pause this video and see the diagram. Drug dependence. Dependence occurs when a person becomes physically or psychologically reliant on a drug. Physical dependence. Withdrawal symptoms occur when the drug is stopped, example, opioids, benzodiazepines. Psychological dependence. The user craves the drug for its effects, example, nicotine, cocaine. Placebo effect. The placebo effect is when a patient experiences improvement in symptoms after receiving an inactive substance because they believe they are taking a real drug. That's all for today. In next video, we will briefly discuss the pharmacokinetics concepts. Thank you for watching. Don't forget to subscribe our channel.